Have you ever found yourself lying in bed at night, just hoping your legs would settle down and give you a break? Maybe you've tried shifting positions, putting pillows between your knees, even getting up to walk around the living room at 2 a.m., only to have that irritating, crawling, tingling, jittery feeling come right back. It's like your legs are trying to run a marathon while the rest of your body is begging for sleep. If that sounds familiar, you're not alone. Restless legs, or what some people describe as electric legs or jumpy limbs, can be one of the most frustrating sensations as we get older, especially after 70. Keeps you from relaxing, interrupts your sleep, and leaves you feeling tired the next day. And here's something that might surprise you. The cause isn't always age or nerve damage. In fact, sometimes the culprit is hiding in plain sight, right in your medicine cabinet. Yes, believe it or not, certain everyday medications, ones that many people over 70 are prescribed regularly, can quietly trigger or worsen those restless leg symptoms. And what's tricky is, they're often medications we take for completely unrelated health issues. Heart, mood, even sleep medications. But when your legs start acting up, it's easy to blame aging, when the real issue might be a side effect nobody warned you about. That's why in this video, we're going to gently unpack this topic together. We'll go over some of the most common medications that have been linked to restless legs in older adults. And we're not here to scare you or tell you to throw your pills away. Absolutely not. But the more you understand what might be affecting your body, the more confident you'll feel talking with your doctor and making adjustments that work for you. Let's begin with one of the most surprising types of medications: antihistamines. Now, I know what you might be thinking. Wait, antihistamines? Like allergy pills? Exactly. Those little pills so many people take for seasonal allergies or to help with sleep. The most well-known ones, like diphenhydramine, which is in many nighttime pain relievers and sleep aids, can actually block a brain chemical called dopamine. And when dopamine gets disrupted, restless legs can suddenly appear or get worse. Dopamine plays a big role in controlling movement in the brain. That's why, when it's not working properly, your legs might feel the urge to move, especially at night when you're trying to rest. And for older adults, our bodies process medications differently than they used to. What might have been a harmless little allergy pill at 45 could now cause uncomfortable side effects at 75. That's something a lot of people don't realize. So if you've been using an over-the-counter sleep aid regularly, especially one labeled as PM or nighttime, take a peek at the ingredient list. If you see diphenhydramine or hydroxyzine, that might be a clue. Again, this doesn't mean you have to stop cold turkey. But it's worth bringing up with your doctor or pharmacist. There are other ways to improve sleep or treat allergies that won't stir up your legs at night. Now, let's talk about another class of medications that sometimes flies under the radar: antidepressants. These are incredibly common after 60, and even more so after 70. And for good reason. Life brings challenges, changes, and sometimes grief or loneliness that can weigh heavy on us. Antidepressants can be life-changing in the best ways. But, and this is a gentle but, some of them, especially selective serotonin reuptake inhibitors or SSRIs, have been linked to an increase in restless leg symptoms. It's not that these medications are bad, they're not. But when serotonin levels increase in the brain, it can indirectly suppress dopamine activity. And just like we mentioned before, when dopamine drops, restless legs may show up. Not everyone will experience this, of course. But if you've started an antidepressant and noticed your legs acting up more than usual, especially at night, it's worth connecting the dots. Now, don't stop your medication on your own. That's never safe. But what you can do is have an honest, relaxed conversation with your doctor. There may be alternative medications, or even a slight dosage adjustment, that brings relief. Sometimes even just shifting the time of day you take it can make a big difference. And remember, your doctor works for you. You're not being difficult by asking questions. You're being smart about your health. Another type of medication that sometimes triggers restless legs is certain anti-nausea drugs. Now you might be thinking, well, I don't take those every day. And that may be true. But some people take them regularly for things like dizziness, vertigo, or nausea related to other health conditions. Medications like metoclopramide or prochlorperazine, names that sound complicated but are used pretty commonly, can affect the same dopamine pathways we've been talking about. So let's say you've been dealing with bouts of dizziness, maybe from blood pressure swings or even from medications, and your doctor prescribed something to settle your stomach. If your legs started getting fidgety soon after, it could be a connection worth exploring. Often, people don't even realize they're taking a medication that affects the brain's movement system. And unless your doctor knows your legs have been acting up, they may not connect the dots either. That's why keeping a little notebook or using your phone to track symptoms and medications can be so helpful. You don't need to write a novel. Just jot down what you're feeling when it happens and what you've taken that day. It can make a world of difference during a doctor visit. And it shows that you're engaged and informed, which is something any good healthcare provider should appreciate. Now that we've touched on a few of these medication types, let's keep going. Because the list doesn't end there, and the more you understand about what's in your medicine cabinet, the more in control you'll feel. We've already started to uncover how common medications like antihistamines and certain antidepressants might be quietly stirring up that crawling, uncomfortable feeling in your legs. And if you've ever felt like your body was trying to send you a message you couldn't quite decode, you're not alone. These small changes, these little signals, often come on so subtly that it's easy to miss the connection, until you start to really pay attention. Let's talk about another surprising category: antipsychotic medications. Now, the name alone can sound intimidating, but here's the thing. Many of these medications aren't just used for psychosis. In fact, they're often prescribed off-label for sleep issues, severe anxiety, or even agitation and confusion, especially in older adults. Medications like quetiapine or olanzapine might be used to help calm the mind or improve rest in someone who's having trouble sleeping due to dementia or other age-related changes. But here's where things get tricky. These medications can strongly suppress dopamine, sometimes even more than antidepressants. And when dopamine gets too low, the body often responds by creating movement, or the urge to move. It might start in the evening, just when you're winding down, and grow more intense as you try to rest. That's why restless leg symptoms are often worse at night. Now, if you or a loved one has been prescribed one of these medications, it's not a reason to panic or feel concerned. In some situations, these medications are incredibly helpful and necessary. But just like with any treatment, it's all about weighing the benefits with the side effects. And if those side effects include sleepless nights and a racing feeling in your legs, it's okay to speak up. There are gentler options out there. Sometimes a tweak in dosage or switching to a different class of medication can make a huge difference in comfort. Next, let's bring up a type of medication that almost everyone over 70 has encountered at some point: calcium channel blockers. If you're managing high blood pressure or certain heart rhythm issues, chances are you've heard of names like amlodipine or diltiazem. These medications are essential for controlling cardiovascular health, especially as we age. But for a small group of people, they can also have an unintended effect on the nervous system. Some studies suggest that calcium channel blockers may alter the delicate chemical balance in your brain and nerves, possibly leading to symptoms like tingling, numbness, or even restless legs. It's not as widely known as the other drug categories we've talked about, but it's something doctors are becoming more aware of, especially when patients mention leg discomfort that seems to have no clear cause. Now, let me say this clearly. Blood pressure medications are important. They help prevent strokes, heart attacks, and even kidney damage. So don't ever stop them without guidance. But if you're noticing a pattern, say your legs start getting jittery every night, especially since starting or changing your blood pressure pills, it's okay to wonder if there's a link. And it's okay to bring that curiosity into the doctor's office. You're not being difficult, you're being proactive. And that's something to be proud of. While we're on the subject of essential medications with unexpected effects, we have to talk about one more group: anticonvulsants and certain pain medications, especially those prescribed for nerve pain. Medications like gabapentin and pregabalin are often given to treat shingles pain, diabetic nerve pain, or even fibromyalgia. They've helped many people feel more comfortable. But for some, they've also led to an increase in restless sensations, particularly in the legs. It sounds a bit ironic, doesn't it? A medication designed to quiet nerve pain, possibly making your nerves feel more active. That's the complexity of how these drugs interact with the nervous system. They don't just target one thing, they influence multiple pathways. And sometimes, in the process of calming one type of discomfort, they might accidentally stir up another. If you've started a nerve pain medication and noticed your legs seem to have a mind of their own in the evenings, or you feel like you constantly need to stretch, pace, or rub them, this could be another piece of the puzzle. Again, this doesn't mean these medications are bad. They've helped millions of people. But your comfort matters too. You deserve to feel good not just during the day, but at night when you're trying to rest. And here's a little tip I always love sharing. If something doesn't feel right, your body is usually trying to tell you something. The challenge is just learning how to listen, and having the confidence to speak up about it. You know your body better than anyone else. Your doctor sees you maybe 15 minutes at a time. You live in your body 24/7. Don't underestimate that wisdom. Now, I know we've covered quite a few medication types already. Some of them might sound familiar and others maybe not. But the takeaway here isn't to memorize a list of drugs or feel overwhelmed by worry. It's about awareness. It's about recognizing that what's going on with your legs might not be just aging or just in your head. There could be a very real, very fixable cause. And the first step to solving it is understanding that it's okay to ask questions. It's okay to look closer. And if you're someone who's felt dismissed or brushed off in the past, I want to say something clearly. You deserve answers. You deserve to feel heard. If you've ever been told it's just your age, when deep down you knew something else was going on, trust that instinct. Our bodies may change with time, but discomfort is not something we should simply accept without looking deeper. Alright, let's keep this momentum going. We've explored how antihistamines, antidepressants, antipsychotics, blood pressure medications, and nerve pain treatments can all play a role in restless legs. There's still more to this puzzle, so let's keep going and dig a little deeper into what else might be contributing to these nighttime leg troubles. Because you deserve peaceful sleep, not a nightly dance party in your sheets. By now, we've touched on some of the most common culprits, those medications that might be helping one issue, but quietly triggering another, especially when it comes to that restless, jittery feeling in your legs at night. And if any part of what we've discussed so far has made a little light bulb go off in your mind, you're already one step ahead. That awareness, that curiosity is powerful. Let's talk about one more group that might surprise you. Over-the-counter sleep aids. Yep, the very pills you might reach for when your legs won't stop moving at night could be part of the problem. Many of these products, like diphenhydramine, which is the main ingredient in brands like Benadryl or some nighttime pain relievers, are actually antihistamines. We've talked about how those can interfere with dopamine levels and make restless leg symptoms worse, especially in people over 70. What's tricky here is that they're marketed as gentle, easy solutions to help you sleep. And it's tempting, right? You've had a long day, your legs are buzzing, and you just want rest. So you take something from the medicine cabinet, hoping for relief. But instead of peace, your body keeps tossing and turning, your legs twitching like they've got a secret agenda. It's frustrating, it's exhausting, and frankly, it's unfair. Because all you wanted was a good night's sleep. The truth is, many of these over-the-counter products weren't originally designed for long-term use. Especially not in older adults. Our bodies become more sensitive as we age. The way we metabolize medications slows down. That gentle sleep aid can linger in your system longer than expected, leading not just to restless legs, but next-day grogginess, dizziness, and even confusion. That's why so many experts now recommend avoiding these types of medications in older adults whenever possible. But don't worry, this isn't about scaring you away from everything. It's about giving you back the power to choose, to ask questions, to explore options that actually work with your body instead of against it. If sleep is hard to come by and your legs won't calm down, there are other ways to find relief. Sometimes, a simple change in timing, stretching before bed, or adjusting your evening routine can make a bigger difference than any pill. Now, before we wrap up, I want to bring all of this full circle. Because this conversation isn't really about medications at its core. It's about feeling in control of your body. It's about finding peace at night and energy during the day. It's about understanding that you don't have to live with discomfort just because you're getting older. Getting older doesn't mean putting up with annoying symptoms. It doesn't mean shrugging off your instincts or staying quiet when something doesn't feel right. That crawling, tingling, irritating sensation in your legs might not be your imagination. It might not be just how it is. It might be your body's way of saying, hey, something's off. And when you take a closer look at your medications, especially those we've talked about like antidepressants, antihistamines, antipsychotics, calcium channel blockers, nerve pain meds, and sleep aids, you might discover a piece of the puzzle you've been missing. So what can you do next? Start by tuning in. Notice patterns. When do the symptoms start? Did they begin after starting a new medication? Or increasing a dose? Or switching brands? Keep a little journal if that helps. Just a few notes about how your legs feel and what you've taken that day can uncover more than you'd expect. And then, bring those notes to your next doctor's appointment. You don't need to diagnose yourself or come in with a list of demands. Just come in with information and questions. A good doctor will listen. A great one will collaborate with you. And if you ever feel dismissed, don't be afraid to get a second opinion. Your comfort is worth advocating for. You might find that a slight change, like switching from a certain antidepressant to another with a lower dopamine impact, can ease your symptoms. Or maybe spacing out medications differently or cutting out that nighttime sleep aid gives your legs the rest they've been craving. Sometimes, addressing other underlying issues like low iron levels or vitamin deficiencies can make restless leg symptoms go away entirely. And here's a little encouragement to carry with you. You are not stuck. You're not at the mercy of your age, your medications, or the label someone once gave you. Every day is a chance to fine-tune your health, to make small adjustments that lead to bigger peace of mind and body. I know how frustrating restless legs can be. I know the toll it takes on your sleep, your energy, your mood. But I also know you have more power than you think. You don't have to accept it as part of aging. You don't have to live in discomfort. You just have to keep listening to your body, asking the right questions, and believing that relief is possible. So if your legs have been keeping you up at night, if you've been pacing the floors, rubbing your calves, trying to outwalk the irritation, know this, you're not alone. And you're not crazy. There might be a very real, very manageable reason behind it. And the journey to feeling better might begin with nothing more than a conversation. With yourself, with your doctor, and maybe even with a friend who's going through something similar. And speaking of friends, don't keep this to yourself. If you know someone else struggling with restless legs or weird nighttime symptoms, share this with them. You never know how one little piece of knowledge could change someone's quality of life. Now, before we close, I just want to thank you for taking the time to be here, to care for your health, and to keep learning. That says a lot about you. And if no one's told you this today, let me be the one to say it. You're doing a great job. You're showing up for yourself, and that's something to be proud of. If you found any part of this video helpful, go ahead and tap that like button. It helps more people like you find this content. And if you want to keep learning, keep growing, and keep feeling better every day, make sure to subscribe and hit the notification bell so you don't miss a thing. I'll be here, cheering you on every step of the way. And hey, drop a comment below if you've had experience with restless legs or if a medication ever surprised you with a side effect. Your story might help someone else feel less alone. Here's to calmer nights, stronger bodies, and more peaceful rest. You deserve nothing less. You know, sometimes the hardest part of getting older isn't the aches or the medical appointments. It's feeling like no one warned you about these small, nagging symptoms that slowly chip away at your comfort. Like restless legs. It's not life-threatening, it doesn't always show up on tests, but it steals something precious. Your peace. Your sleep. Your ability to wind down and truly rest. And the strange part. You might go months, or even years, without realizing that something in your medicine cabinet is the root cause. We often assume that our prescriptions are helping every part of us. And while they do help in big ways, the side effects, especially in older bodies, can creep in quietly. That's why it's so important to stay curious, to be your own best advocate. It's easy to feel overwhelmed when you start looking at everything you're taking. Maybe it's 5 different medications, maybe more. You might wonder, where do I even start? Let me tell you, you don't have to do it all at once. You don't have to have it all figured out. All you need is the willingness to ask a few gentle questions. Does this medicine still work for me? Has anything changed since I started taking it? Is it helping me more than it's hurting me? These questions are powerful. They open the door to conversations that could lead to better sleep, less discomfort, and more energy. And while we're on the topic, let's not forget how powerful lifestyle shifts can be too. Gentle stretching before bed, warm baths, magnesium-rich foods, staying active during the day. All these can ease restless legs, especially when paired with a mindful approach to medication. But even more than tips and tactics, what I want you to walk away with is a sense of hope. You don't have to accept everything that comes your way just because you're over 70. You don't have to suffer in silence, or chalk things up to just getting old. That buzzing, crawling feeling in your legs, that's not just age. That's your body trying to tell you something, and it deserves to be heard. You've spent a lifetime taking care of others. Maybe as a parent, a grandparent, a partner, a friend. Now it's your turn. Now is the time to take care of yourself just as fiercely and patiently as you've cared for others. And that starts with listening. Not just to experts and doctors, but to yourself. No one knows your body better than you do. That instinct you feel when something's not right matters. It's worth paying attention to. So as we close out this conversation, let this be your reminder. Relief is possible. Comfort is possible. And the first step doesn't have to be big or scary. It can be as simple as saying, I'm ready to look at this differently. You're not alone in this. There's a whole community of people walking this same road. People who are waking up to the idea that growing older doesn't have to mean giving up control. Can mean reclaiming it. If you found this video helpful, I'd love for you to share it with someone who might need it. Whether it's a friend, a sibling, or someone in your walking group, let's keep the conversation going. Because sometimes, the best medicine is knowing you're not the only one going through it. And if you want to stay connected and keep learning, don't forget to hit that subscribe button and tap the bell. Every week, we share new insights, tips, and gentle encouragement to help you live well, because you deserve that every single day. Take care of yourself. Listen to your body. And never stop believing in the possibility of feeling better. You've still got so much life ahead, and you deserve to enjoy every step of it, with legs that feel calm, rested, and ready for whatever's next. Here's to quiet nights, stronger days, and the confidence to ask the questions that lead to healing. I'm so glad you're here, and I can't wait to see you in the next video.